In a community that likes to keep to itself, even tragedy can remain in the dark. But for one mother and father, a phone call meant everything would change.
He says, he's very sick and I need to take you to him.
The call was about their son.
When it happens to you, you realize nobody's immune.
Now they feel there's no choice but to speak out.
This debilitating shame is one of the things that prevents addicts from getting the help they need.
You okay in there?
Yes, thank you.
Okay.
Should people fighting addiction have to look for help in here?
This is not the answer. Having a bathroom is not the answer.
Activists believe it's better to create safe consumption spaces where drug users are under medical supervision in a clean, calm environment.
So if someone injects in one site, they're able to be coached by a nurse to inject in another site.
And they can leave this kind of trouble behind.
And whenever I didn't have the time to locate a vein properly, I would just get it in there, pow, you know?
This week, the opioid crisis, and how every day it's becoming more and more high profile.
When the United States Congress passed the Comprehensive Drug Abuse and Control Act of 1970, it categorized controlled substances based on their potential for addiction. 1 year later, a congressional report found 10 to 15% of U.S. servicemen actively deployed in Vietnam were addicted to heroin. Now, never one to waste a good tragedy, Richard Nixon used the findings to launch what he branded America's war on drugs by declaring drug abuse public enemy number one. Nixon waged his war on 3 fronts. Eradication, that's the complete destruction of drugs where they originate. Interdiction, preventing the movement of existing drugs. And incarceration, confining drug dealers and users to prison. As for eradication and interdiction, if you know the right guy, you can have drugs delivered to your house in slightly more time than those other guys promise a pizza will show up. So that's a fail. But that last one, that was a slam dunk in more ways than one. The day Nixon declared his war on drugs, there were about 200,000 Americans behind bars. Over 4 decades later, the U.S. prison population is north of 2 million. Now, to be fair, all those people aren't locked up because of drugs. But in the year following Nixon's declaration, police did arrest 100,000 more people on marijuana charges. Although he probably never took a puff, President Nixon surely did not pass on the idea of marijuana as a gateway drug. The gateway to power. In an article that ran in the April 2016 edition of Harper's Magazine, former Nixon domestic policy chief and Watergate co-conspirator John Ehrlichman outlined the inner motivation behind Nixon's outward declarations. We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Do we know we were lying about the drugs? Of course we did. Are drug abusers the victims of their own environments or their own personal vice? Or a pharmaceutical industry that wrote 259 million prescriptions for opioids in a single year? I was the victim when my aunt stole my leather jacket and pumped it into her veins. But feels aside, is drug addiction a political, moral, or medical issue? 45 gets to steer the course for how we steer this ship. Make opioid addiction a national emergency, build a wall to keep out drugs, or continue to warehouse addicts and those who sell to them. America has a drug problem it can no longer confine to the ghetto. 20,101 overdose deaths related to prescription pain relievers, 12,990 because of heroin. If New Hampshire is the new drug den, it doesn't matter who came over on the Mayflower. We're all in the same boat now. So let's go in.
Families all over America are dealing with the ravages of substance abuse, none more so than the parents of drug users who died from an overdose. They feel an equal opportunity pain, one that doesn't discriminate based on race, ethnicity, income, or even religion.
My name is Sarah Benjamin. I am a Hasidic housewife, mother of 10 children, living in Brooklyn.
My name is Tony Benjamin. My Hebrew name is Yehuda Benjamin, and we live here in Crown Heights.
It was an evening. We were out driving back from someplace, and I got a call on my cell phone from Hatzalah, which is the Jewish community's paramedic organization. He said, "You have a son living in Crown Heights. His name is Kasriel." And I said, "Yeah." He says, "He's very sick and I need to take you to him." He said there was an overdose. And I said, "Is he still alive?" And he said, "They're working on him."
Is kind of the phone call you never believe you're ever going to get. Underneath, you know, this is not good. Even though they're working on him, this is not going to end well.
Say something. How'd you know?
You have it holding up like that.
No, say something.
Okay, so this is, we're on hour, 8 of our trip back from Bonnaroo. We're tired. We're hot.
You're shuckling.
Shuckling.
And it's his birthday.
It is actually my birthday.
Say it's Dvar Torah.
Dvar Torah.
With your
I
shuckling.
couldn't even breathe at that point. I was trying to tell Tony, and it was hard to get the words out. And we got home a couple minutes later, and he took us to Crown Heights, to his apartment. The police were there. It was nighttime, and people milling around, and then I was shaking, and I had to sit down on somebody's stoop.
In reality, when they said they're working on him, he'd actually been dead for many hours already. So that ride was just dreadful.
It was just total shock. Honestly, losing a child is so huge and so life-altering.
This is stuff you read about in the paper with somebody else. Like you read in the paper, somebody's kid unfortunately died of an overdose. They lived in Queens, and maybe a Jewish family, a Christian, whatever. And you say, oh, that's really sad. And then you go back to your newspaper. When it happens to you, you realize nobody's immune from some of this stuff.
I don't know what that is.
What is this?
This is when he was born.
Oh yeah, look at that.
See, it was little then. So that's his leg thing from the hospital.
When he was born.
Yeah.
Yeah. Did they post a picture?
Kasriel was the fifth of 10 children, 8 boys, 2 girls. He was 25 years old when he died of an overdose. He was very, very sensitive and outgoing at the same time, loved people.
Very upbeat person altogether. Part of his character was to be a peacemaker. And he very much liked to see everything running smoothly, people getting along. Kazi was one of those special souls who transformed the world for the better. He was immensely kind and always spoke so highly of you all. That's us.
And then he was working, he had various jobs, working with other young men in different companies. He had found his thing yet when he died.
So this is the little pieces of his hair that was cut when he turned 3.
We don't cut their hair till they're 3.
And especially even within the Jewish community, a community which is kind of self-contained and self-sufficient, and you feel that somehow, because you're in the religious kind of area, that your kids are somehow protected from this stuff to some degree. And it's just not true. What normally happens when a kid dies is that often the community will not ask a direct question. They won't ask, how did the kid die? Because sometimes they don't want you to have to say the answer if it's something on, you know, a drug addiction or a suicide or some other thing that may be problematic.
Addiction or mental illness are considered moral defects to some degree still. It's a devastating blow to the family.
It's a very courageous couple. They've come forward and they've spoken about it openly, and I know it's hard. It's hard to do that. It's hard to speak about it openly. It's hard to speak about the death of a child.
Both my wife and I felt it was time to begin to chip away at the shame and the stigma that is attached to the disease of addiction, be it drugs, alcohol, or whatever. This debilitating shame is one of the things that prevents addicts from getting the help they need.
As a result of their outreach, of them talking about it in the open, they are encouraging, first of all, parents to take preventive measures. They're encouraging people that may be struggling that it's normal to happen. Anybody can become addicted to drugs, but you have to seek help. So it's very, very simple. You take the naloxone, goes in here, and you put a little nasal piece here. Operation Survival was the first opioid overdose prevention program in New York. We distribute naloxone, a drug that reverses the effect of an opioid. We're losing too many children to drugs, and there's a need to teach children about drugs and about the dangers of drugs.
The opiate epidemic, is coming from the availability of painkillers, and the drug companies freely encourage doctors to use and stuff.
When Kasriel died, we know from his friends that perhaps the usage wasn't just heroin, that he had been taking doses of Xanax, and that tied to heroin can certainly be fatal if you take enough of it. Because it's a regulated prescription drug, it almost has the sense of legitimacy. It's not a thing you go buy on the street corner from a little packet of a guy you don't know and don't trust. This is manufactured by a legitimate pharmaceutical company, and the addicts quickly learned how to break it up and snort it.
We did a campaign in Crown Heights where all the shop owners used Operation Survival bags, where the bag said, teach youth to refuse to use. The purpose of these bags were to start a conversation. We gave it about 15,000 bags. We walked up Kingston Avenue and Albany Avenue and all the stores. People were carrying these bags in the neighborhood.
It's easy to think of that as absolute failure as a parent. Like, you couldn't even do the basics, keep the kid alive. One of the reasons why I'm willing to talk to people is you want something positive in your life, not just this sinking negative feeling. And if it has a purpose, like where you can help people with it, that helps a lot.
Anyway, and
Chai doesn't want to sleep.
okay, that's it, right?
I don't know. I have more things to say. I don't really have much to say.
Okay, say bye-bye.
Bye-bye. Signing off for now. Till next time.
Peace.
Any kind of movie scene or thing where you see some kind of tenderness or connection with people, also it's just very emotional thing that somehow kicks in. So it's better, but it's never disappears.
I'm from Kentucky. You know, I remember when people, myself included, first started using pills, started taking pills. We didn't think anything of it. We didn't know what that meant. I remember when some of my friends then graduated to heroin, and I remember when people started to overdose. And I still occasionally get that call or find out about the person who I haven't seen in forever who died. I remember someone dying and a friend of mine saying, I just that, surprised it took so long for him to die.
What do you wish would have been there for your friends so you wouldn't have had to get that call?
They needed people who would say, hey, whether you're using or not, I want you to talk to me about it. I want you to open up about it, right? The reality is naloxone doesn't work if you're alone when you're using. Good Samaritan law, the 911 law doesn't work if you're using by yourself. You gotta be able to tell people you're using. And unfortunately, you've gotta be able to tell your loved ones and friends and family, hey, I don't want you doing this, but most importantly, I want you to be able to be open and honest about it. And we have to do that for one another, and we have to send a message to these politicians to let them know they need to send that message, and they need to give us the tools to then help our friends and family, right? When they're ready, we need to be able to help them get access to buprenorphine, to drug treatment, to what they want in their life.
If drug users are inherently safer when they aren't left alone while using, what sort of support systems can be implemented to ensure their safety and save lives? Vocal New York is actively lobbying for New York state legislation to legalize one such solution.
We're at a crossroads as a society, I feel. We're amid many epidemics. We're amid an epidemic of opioid overdose. We're amid an epidemic of hepatitis C infection. We need to decide at this point whether or not we are going to choose to accept people as they are and to create interventions that accept them, or if we are going to continue to punish people for who they are and what they do, continue to grow mass incarceration, continue to isolate and stigmatize people and push them off into the corner of society instead of embracing them as part of it.
I don't feel comfortable going there myself. If you would go with me.
Yeah, I can totally escort you.
Because I feel like that she is treating me differently because I'm a drug user.
We're spending a lot of like tax dollars on deceased, curing people from diseases, where we should be also investing money on prevention. Safe consumption spaces, harm reduction, needle exchange programs. These are all preventions.
Prohibitionism has been a traditional approach to drug use, and we know that that didn't work, and we've seen it continually fail us over the course of history. Harm reduction has evolved with the use of different substances and with the creation of networks and capacity building. So as a community of harm reductionists, we continually are able to make recommendations for each other and learn from each other. And one of these instances is safer consumption spaces. This is something that's existed for over 30 years across the world. We have research from Europe, we have research from Australia, from many other countries that show this is a proven effective method.
All these deaths that we're seeing right now, these are all things that could be avoided. Like if we were able to have safe consumption spaces and we were able to give people space where they could actually get educated and we could prevent a lot of the things that we're seeing, it will actually work. And we'll see less people having Hep C, less HIV transmission, less death caused by overdose.
I can't speak good enough for a supervised injection facility of this. I had an instance where I had a possible overdose, and unfortunately, I had to be transported to a medical facility to receive, Narcan. With the fentanyl coming in and stronger analogs of fentanyl, people don't have that time. So again, at safe injection facility, everything's there. The medical staff, the life-saving drug, the life-saving techniques. Really, it's win-win, really.
What we have in here is a model SIF. It's not a place that we allow safe injection. This is actually a room that we demonstrate. If we have any politicians or anyone who is interested in learning more on safe injection, we're able to bring them over to our safe consumption space, which has a stainless steel top. They would come in with their substance of choice. They would receive a tray with all of their injection materials, and there would be a nurse standing behind them, giving them instruction and teaching them how to inject safely. Once the person is done, they're able to discard of all their materials here in the sharps container, and then they'll be able to come and hang out in the chill room. And this is where they'll be able to actually engage in any counseling, or if they want to just hang out and just spend some time within the room.
Under the supervised injection, you have, you have time, whereas the alternative is, a public bathroom where you don't have time. It's very, you got to worry. It's people knocking on the door, could be police, this and that, or outside, in cars, basically an unsafe place. Me, I had caught a nasty epidural abscess. Basically was from missing. And whenever I didn't have the time to locate a vein properly, I would just get it in there, pow, And after doing this with enough, dirty street drugs, I would get, abscesses on my arms.
Once a person is actually here in the safe consumption room, then what happens is that we're not bringing any injection materials into the community is one thing. So there's less risk of any children playing with any syringes or any syringes littering the street. It also allows for a more sanitary environment for injection. Currently, if anyone is injecting because of the stigma for it, they're going between cars, they're going in an alleyway, there could be fecal matter in the vicinity. This basically allows them to come into a space where everything is sanitary, everything is clean, and also allows them to engage with any primary care or any health care afterwards once they're done. Injecting in a safe consumption room actually can reduce the risk of any bacteria entering into the bloodstream or under the skin, which can cause abscesses or infections. Being here would allow not only for sanitary, but also coaching through that. So if someone injects in one site, they're able to be coached by a nurse to inject in another site, or just to be more sanitary in handling with their works. So it reduces the risk for hospitalizations, emergency room visits, and primary care and all.
We want to have a place where people are going to be treated like people, not like a pest or a nuisance, that they could be seen as somebody that by themselves, not because they're somebody's daughter or son, or no, because they are worth it. It's not going to be just a place where they're gonna use and then run. No, they may come, settle, talk to people, talk to a counselor. If they have something on their mind, share it. Even use the phone, talk to their family. Beginning with just a hello, acknowledgement of that person, where maybe that whole day they have been walked by without nobody saying anything to them.
At Vocal New York, we're an organization that advocates for people who use drugs, for people who are homeless, for people at the intersections of many health and social inequities.
You okay, man?
Yes, thank you.
Okay.
We have 2 different sharp containers in the bathroom, just to have it out there for people to safely dispose of their sharps, right? These are sharp containers that people cannot get into. People will not be able to reuse any sharps that are in there. Once the sharp is in there, it's fully disposed. We have gloves at all times in the bathroom. The door has a buzzer system where we're able to buzz if we ever need to get in here for an emergency. Can you guys buzz the door, please? See, because that's the buzzer system. So anybody that's in here, if they're not able to answer or open the door, we're able to get in here and buzz the door open, and we'll get in here able to do whatever we need to do, whether it is administering naloxone, if it is using the ambu bag, if it is monitoring the person's oxygen level. But this is just a bathroom. It's not a safe consumption space. This is something that we did out of the necessity to try to avoid all the death that we're seeing in our community. This is not the answer. Having a bathroom is not the answer. It's one thing that we needed to do because we were tired of seeing our brothers and sisters dying.
The reason we put the demand for supervised injection facilities or safer consumption spaces in the forefront is because we know they seem more radical. We know that if we can get politicians to talk about and fight for the need to create these facilities, which do work, which provide a critical role, we can win the other things we need. Bigger investments in the Department of Health, bigger public health education, public education campaigns, more investment in access to drug treatment that works, that is rooted in science and evidence, and not just punitive approaches.
So there's someone yelling at their TV right now. I call bullshit on that. It's about not taking drugs. I don't take drugs. If you didn't take drugs, why should my tax dollars go to make sure you get to shoot up in a nice, clean place?
For better or worse, people have used substances and will continue to use substances forever, right? And here in the United States, we really have the perfect historic example, right? We had this thing called prohibition. We had this moment where our country prohibited alcohol, right? And we know what happened now. Alcohol became unregulated, it went into the black market, and what we had was the creation of way more toxic, unregulated, deadly alcohol, right? So we had a lot bigger public health consequences. Also, we had an increase in violent crime and in organized crime because, again, organized crime found a way to flourish, to make big profits, right? So what we have in this country is a perfect historic example of what prohibition does. It leads to the substance that we're talking about becoming unregulated, going underground, and becoming far more deadlier and not in control. And it leads to organized crime and it leads to violent crime.
Thanks to everyone who shared their story and to you for giving us your attention. We appreciate it. And if by any chance you'd like to see a little more, be our guest. Going In is online at youtube.com/BRIC TV. I'm Brian Vines. Bye now.